Hello everyone. In this class, we'll try to learn about dialysis. The basic principle of artificial kidney or dialysis is to pass blood through minute blood channels bounded by a thin cellophane membrane. On the other side of the membrane is a dialyzing fluid into which the unwanted substances in the blood pass by diffusion. Cellophane is a porous enough to allow all the constituents of plasma except the plasma proteins to diffuse in both the direction from plasma into dialyzing fluid or from the dialyzing fluid back into the plasma. If the concentration of substance is greater in the plasma than dialyzing fluid, there will be net transfer of substances from plasma into dialyzing fluid. The rate of movement of solute across the dialyzing membrane depends on the concentration gradient of the solute between two solutions, permeability of the membrane to the solute, surface area of the membrane, and the length of the time that the blood and fluid remain in contact with the membrane. Dialyzing fluid. The concentration of ions and other substances in the dialyzing fluid are not same as that in normal plasma or uremic plasma. They are adjusted to the level that are needed to cause appropriate movement of water and solutes through the membrane during dialysis. It contains no creatinine, urea, or other substances to be completely removed from the plasma. So this is the setting of dialysis where the arterial blood which is taken from the patient through the pump, it is pumped into the dialyzer, before which the anticoagulant is added to prevent coagulation, and the blood is going to run in this particular direction, whereas the dialysis fluid will be run in opposite direction, which is going to reabsorb all the unwanted substance from the blood, and then thus the resultant blood which is made air free, and it is sent back to the venous channels of the patient. Renal failure. Renal failure refers to the severe deterioration of the renal function. It has uh, it has two types. It is of two types: acute and chronic. Acute renal failure, where the onset of this condition is sudden, that is, it can occur within days or weeks. It may be due to decreased blood supply to the kidneys or obstruction of the urinary collecting system. Chronic renal failure refers to slow, that is, over a period of months. It is irreversible deterioration of the renal functions. It results from diabetes mellitus, glomerulonephritis, pyelonephritis, and tuberculosis. Nephrotic syndrome. It is characterized by loss of large quantities of plasma proteins into the urine. The cause of protein loss in urine is increased permeability of the glomerular membrane. So diseases like chronic glomerulonephritis, amyloidosis, which increase the permeability of the membrane, can cause nephrotic syndrome. As a consequence of decreased plasma protein concentration, the plasma colloidal osmotic pressure falls to low levels. This causes the capillaries all over the body to filter large amounts of fluid into the various tissues, which in turn causes edema and decreases plasma volume. Renal sodium retention in nephrotic syndrome occurs through multiple mechanisms activated by leakage of protein and fluid from plasma into the interstitial fluid, activation of sodium retaining systems such as renin-angiotensin system, aldosterone, sympathetic nervous system. However, because of the large amount of sodium and water retention, the plasma protein concentration becomes further diluted, causing still more fluid to leak into the tissues of the body. Fanconi syndrome. It is associated with increased urinary excretion of amino acids, glucose, and phosphates. In severe cases, the manifestations are also observed, such as failure to reabsorb sodium bicarbonate, increased excretion of potassium and calcium, and failure of kidneys to respond to antidiuretic hormone. The causes of Fanconi syndrome are hereditary defects in the cell transport mechanisms, or toxins or drugs that injure the renal tubular epithelial cells, or ischemia, which causes injury to the tubular cells. The proximal tubular cells are especially affected due to the tubular injury. Nocturnal enuresis. Voiding of urine in bed during sleep is normal in infants and young children. Nocturnal enuresis is sometimes seen in older children and adults due to organic lesions, for example, lumbosacral vertebral defects, and also due to some psychological factors. Urinary calculi and renal stones. These are mainly composed of calcium stones, that is, calcium oxalates, calcium phosphates. It may be sometimes also due to uric acid. They cause obstruction to the urine flow. Complications include vomiting, sweating, fever, severe pain, and hematuria. They are treated with flushing and minor surgeries. So, this is in brief about uh, the dialysis and the renal failure. Thank you.